with our lunges, we've got many options in order to either bias certain tissues or deload certain tissues. And that's really where this is going to come into its own now. And we're going to use our knowledge of 3D movement. There's a physical therapist in America called Gary Gray. He was the one that first introduced me to this idea. And what I've done is I've taken these concepts, but ultimately fitted them into the step-by-step system so that we can use them at the appropriate times. So with the rib cage, an understanding of the rib cage reactions, as we've looked at already in previous lessons, can give us an idea if we want to put extra load through certain parts of the body, or we want to deload them. So for example, with the sagittal plane lunge, as I lunge forward, this to me will be the middle, I suppose, progression, for want of a better word. If I have an athlete with a ankle injury and I want to take less load on the ankle joint, then I've got a few different options here. So this will be the middle progression. A regression for that, okay, will be is if I lunged and I reached forward. So if I lunge and reach forward, you can see that's going to put my hip joint in a much better length tension relationship to do work. Okay, so if I reach forward as I lunge, there's going to be less work being done at the ankle, more work being done at the foot. So if I go back then to my middle progression, okay, now we're doing equal, for example, to keep it simple. But if I want to put less work at the hip and more work at the ankle, then as I lunge, I can reach my hands overhead. So by reaching my hands overhead and elevating my rib cage, I shorten the hip, okay, I put slack into the hip muscles, which then ultimately means I'm going to have to take more load through my ankle joint. So this exercise for an ankle will be a progression, whereas this exercise for an ankle joint issue will be a regression. The beauty of this is if I had a proximal hamstring strain, or I had a proximal hamstring tendinopathy or some issue with my hip, it would be the reverse. So this will be the middle progression. For a hip joint, this will be a regression because I'm taking load off the hip and I'm putting more down into the ankle. And then this is the exercise that's going to stress the hip more, okay? So understanding the reactions that happen throughout the body can give us a really simple way to either progress or regress a patient within the same session. So if this is too hard for them, then I can regress them or I can progress them depending on what area of the body I want to do or I want to stress. So I can put more load through the joints, or I can even put more load through certain parts of the tissues.